Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is hematocrit. So first of all, what is hematocrit? Hematocrit or HCT is the blood test that measures the percentage of your total blood volume that is made up of red blood cell. Basically, the percentage of red blood cell is known as hematocrit or packed cell volume. So what is hematocrit? Hematocrit or HCT is a blood test that measures the percentage of your total blood volume that is made up of red blood cells or erythrocytes. Now, how it is determined? First of all, a blood sample is placed in a capillary tube and centrifuged for almost 30 minutes, which separates the blood into three distinct layers of plasma. That is, one is plasma that is clear yellowish fluid liquid at the top. Then the buffy coat or buffy layer, which is white blood cells and platelets in the middle, and in the bottom that is red blood cell or RBC. So first of all, we collect the blood sample from a patient or a person. Then we put that blood into the capillary tube, and then it is centrifuged for almost 30 minutes and for 3000 RPM speed. Now after 30 minutes, we get a three distinct layers. In the upper level, that is plasma, which is clear yellowish liquid at the top. Then the buffy coat, which is white blood cell and platelet in the middle, and red blood cell at the bottom. The hematocrit value is then calculated by dividing the height of the red blood cell layer by the total height of the blood sample or RBC and plasma and multiplying by 100. So the measurement process is, the hematocrit value is calculated by dividing the height of the RBC layer by the total height of the blood sample like RBC and the plasma, and by multiplying by 100. Now the normal hematocrit values. Normal hematocrit values ranges can vary slightly by laboratory, age and sex. Typically, in case of male, it ranges from 40 to 55% In case of women, it is 36 to 48%, and newborns, it is 55 to 68%. But this is the basically normal. In case of male, 40 to 54. In case of women, it is 36 to 48, and in case of newborn, it is 55 to 68. Now, why it matters? Why the hematocrit value is important for us? First, anemia and then polycythemia. In case of anemia, a reduced hematocrit value can indicate anemia, a condition where the red blood cell blood does not have enough healthy red blood cell. And in case of polycythemia, in an increased hematocrit value can be a sign of polycythemia and a condition with an excess of RBC. So, the importance of hematocrit is a test which will help to determine a disease or diagnosis. It is a diagnostic value. So one is anemia, one is polycythemia. In case of anemia, the RBC is decreased. In case of polycythemia, the RBC is increased. What we will see in case of in the hematocrit, when the anemic patient hematocrit value is so that the level of RBC is low. In case of polycythemia, the RBC level is high. Next, the factors that can affect the readings. First is anticoagulant. An increased amount of anticoagulant in the blood sample can lead to a lower hematocrit reading because it causes red blood cells to shrink. If the anticoagulant quantity is increased, then the hematocrit value may be slightly lower because it causes red blood cells to shrink. And sealing. Improperly sealed capillary tubes can lead to blood loss during centrifugation and resulting in decreased hematocrit reading. Centrifuge. Forcing the centrifuge to stop or failing to remove the tube immediately after it stops can cause the red blood cell to settle or shrink, leading to a falsely elevated reading. And the buffy coat, a layer of WBC should not be included in the measurement as its inclusion will falsely elevate the hematocrit result. So these are the factors. One is anticoagulant, one is sealing, one is centrifuge, one is buffy coat. So what we have learned today? Today, first of all, we have learned about what is hematocrit, then how it is determined, and the normal hematocrit values. Now why it matters or importance of hematocrit. Now the factors which can affect the readings. And lastly, thank you. So if you have any query, any doubt about this topic, you can comment down in the comment section. I will try to reply them all. And thank you so much for it watching. Do like, share, and subscribe to my channel for supporting me and my channel. Thank you so much.